Today we are going to look about the major mental health killer, the borderline personality disorder. Before going into the chapter, if you haven't subscribed our channel, please subscribe and keep supporting us. Borderline personality disorder is a serious mental health disorder. It affects your perception of yourself and the people around you. People with BPD do not like to be alone and have an intense fear of being abandoned by their loved ones. However, they may experience mood swings, anger issues, irritability and impulsivity that push the people they love away from them. Individuals with borderline personality typically have unstable relationships. Their emotional issues may also impair their ability to carry out routine tasks on a daily basis. Nevertheless, borderline personality disorder is very treatable. Many people with BPD go on to live healthy, happy lives after availing themselves of therapy, medication, and effective support programs at a private rehabilitation retreat. People with borderline personality disorder may experience these symptoms such as: first one is a strong fear of abandonment or rejection. Second is self-image issues. Third is trust issues. Fourth is intense, unstable relationships. Fifth is stress-related paranoia. Sixth is high-risk and impulsive behaviors. Seventh is mood swings that may last from hours to days. Eighth is anger issues. Ninth is feelings of emptiness. And the final one is suicidal threats in response to fear of separation or abandonment. Approximately 70% of people with borderline personality disorder will attempt suicide at least once during their lifetime. Roughly 10% of individuals with BPD will complete suicide, a rate that is more than 50 times the suicide rate in the general population. When we analyze the causes of borderline personality disorder, the exact cause of borderline personality disorder is unknown. However, medical and mental health researchers agree that environmental and genetic factors play a role in the onset of the condition. Some scientists have hypothesized that BPD is related to amygdala dysfunction, which can lead to an overreactive fight or flight response. Additionally, many researchers believe there is a link between early childhood trauma, such as perhaps due to parental abandonment or abuse, neglect, bullying, or sexual assault, and BPD. Borderline personality disorder usually begins in early adulthood. However, symptoms of BPD may become less intense as the affected individual gets older. Sad thing is that the borderline personality disorder is often misdiagnosed by many doctors. As the symptoms of BPD are similar to many other mental health conditions, it can be very difficult to diagnose. For example, bipolar disorder may sometimes be confused with borderline personality disorder because they both involve mood swings. However, unlike bipolar disorder, people with borderline personality disorder do not experience the euphoric highs of mania. Another factor that may contribute to an incorrect diagnosis is the fact that individuals with borderline personality disorder may have comorbid issues. These issues may include depression, anxiety, bipolar disorder, eating disorders, post-traumatic stress disorder, and substance abuse problems. Roughly 75% of people diagnosed with borderline personality disorder are women. This gender difference may be due to the fact that women are more likely to seek professional mental health care and are therefore more likely to receive a BPD diagnosis. It has also been suggested that women may be more prone to developing borderline personality disorder than men. Men and women may also experience different symptoms of BPD. For example, women are more likely to struggle with dissociation and parasuicide. On the other hand, men usually have substance abuse and anger issues. Women with BPD are most often treated by psychiatrists or psychologists who specialize in women's health. Men with BPD typically receive mental health treatment from counselors trained in addiction recovery. Counseling and medication can help to the borderline personality disorder patients. Although people with borderline personality disorder may experience a great deal of emotional distress, effective treatment is available. Many men and women who seek therapy are helped to readjust maladaptive thinking patterns and find healthy ways to manage their symptoms. Individuals with intense symptoms may benefit from a combination of talk therapy and medication. If you believe you are showing symptoms of borderline personality disorder, it is recommended that you speak with a licensed mental health provider so that you can get a professional diagnosis and develop a personalized treatment plan. Thank you.